this morning just exemplifies, but it's often an underestimated factor in insulin resistance and heart disease and also in autoimmune disease. So we'll talk a little bit about that today. So standard disclaimer, we're not trying to diagnose or cure any diseases here, just for educational purposes. So one of the most important studies here is chronic stress and insulin resistance, the related indices of cardiovascular disease risk, how it affects the neurophysiology response, and what happens after that. So we know chronic stress activates the hypothalamus, pituitary, and adrenal axis and induces hypercortisol, which cortisol's main action is to increase blood sugar. So I was just talking with a patient yesterday. One of the main purposes for this lecture today is to give people new tools or additional tools to deal with the epidemic of insulin resistance and metabolic syndrome. We all have lots of tools. I mean, we all have heard about insulin resistance before. We all know what insulin resistance is, but there's some clinical tools that I think are underutilized. So I was just talking to a patient yesterday, and of course she has insulin resistance, as many of them do when they first come see me, and she was talking about, well, I'm really working hard on changing my diet, and this is the second visit I've had with her, and we were going over the blood work, and I mentioned to her, well, hey, there's more than just diet in dealing with insulin resistance. There's dealing with stress, and she was pretty amazed. She was kind of shocked. She never really thought of stress as being a cause of her insulin resistance or being a main cause. We all know diet is a big issue that needs to be addressed, and lifestyle and exercise, but stress is often overlooked or sort of passed over as a main cause and therapeutic endpoint for treating insulin resistance, metabolic illness, metabolic disease, and autoimmune. So this hyperglycemia induces hyperinsulinemia, and that causes dyslipidemia, which causes adiposity and inflammation, which induces endothelial dysfunction through the inflammation, cardiovascular inflammation, and then systemic inflammation. And then that systemic inflammation in turn is more of a stressor. So you get this vicious loop, feed-forward loop, that causes stress, inflammation, more stress. A particular note, chronic elevated levels of cortisol predicts hippocampal atrophy and inhibits neurogenesis and synaptic remodeling. That's not anything new, but when we relate that to the stress effects and insulin resistance, when you damage the hippocampus and you inhibit neurogenesis, what you're doing is creating a stress event in the brain, and that in turn activates more of the hypothalamus, pituitary, adrenal axis. So just the fact of damaging the brain will cause more stress, more cortisol, epinephrine, norepinephrine, and higher glucose levels, and so you get a greater vicious cycle. So this is just a schematic of how stress causes the HPA and sympathetic nervous system activation, but we'll talk today and focus today on why the systemic inflammation really is what damages the insulin receptors, creates glucose intolerance, dyslipidemia, visceral adiposity, hypertension, etc. Then you have adverse cardiovascular responses to that, but then that feed forwards back into the structural remodeling of the hippocampus and amygdala. This is not good structural remodeling. This is adverse changes in mood, so you're more likely to be more stressed. So stress induces stress, so it becomes a vicious cycle. So one of the first novel ways of thinking about insulin resistance and treating insulin resistance is to really work with the stress. And one of my favorite tools is using Serene Renew. This is designed to modulate. It won't lower cortisol if someone's in adrenal fatigue, but it will lower cortisol if someone's in a hypercortisol state. And so Serene Renew is one of my favorite. It's definitely what we call in my office a fan favorite. Patients love it. There's few supplements. Most of the time, patients come in and they ask me, well, you've got me on a lot of supplements. Can we drop any? Am I better now? Can I stop taking some? But Serene Renew is almost always people. Please don't take me off Serene Renew. I love Serene Renew. I want to keep taking that because it's designed to it's different than say the action of phosphatidylserine. It's designed to work with GABA receptors. It's designed to modulate inflammation, whereas phosphatidylserine doesn't do that. It works on many different hypothalamus, pituitary, and adrenal axis endpoints. So kava, passion flower, phenibut, valerian, theanine, which is one of the best for reversing the structural damage in the brain that happens due to stress and elevated blood sugar. It's designed to use kind of during the day. It doesn't make you sleepy. You'd have to take 6 of them in order to kind of get sleepy. So 1 or 2 is usually works for people who either have chronic stress or who just want to feel better, or who are going through pretty acute stressor, which we all have in our lives sometimes. So job changes, relationship changes, death in the family, whatever. So Serene Renew is a powerful tool for lowering cortisol and lowering chronic elevations of blood sugar by lowering that stress response and increasing the stress resilience. BP Renew has kind of the main ingredients that are in our toolbox for treating insulin resistance from a traditional standpoint. So grapeseed, taurine, and lipoic acid all are first line or front line therapies in natural medicine for insulin resistance and diabetes and stuff. So the BP Renew is phenomenal for that. But we'll also talk about Methyl Renew and how that's used to support metabolic syndrome and insulin resistance. NAC is also pretty well known for reversing insulin resistance, and it's many studies with polycystic ovarian syndrome. DHEA pregnenolone, St. John's, LV Renew, Complete Neuro, these are all things that can help deal with the stress response and the hypercortisol. Another novel way of looking at the stress damage that happens with increased inflammation from the stress is what happens to the oxidative damage. So we'll talk about that a little bit later. But oxidative damage from upregulated adrenal cortex and medullary cells causes accelerated cell death and depletion of the adrenals. So this is one mechanism. In addition to just over-secretion of cortisol, you get an increase in oxidative stress. So LV Renew, Methyl Renew, NAC Renew helps protect the adrenals and protects the body from developing insulin resistance due to stress. This is one of my favorite slides. I can talk about this slide for about 3 hours, but we've already gotten started late, so I'm not going to talk about it for 3 hours. But when you replay this seminar, if you go onto the NutriWest website and replay this webinar, you will, you can pause here and just look at this. But we see that stress initiates this whole cascade, and we'll talk about that. But insulin resistance, the polycystic ovarian syndrome, non-alcoholic fatty liver disease, type 2, increased fasting insulin, increased fasting glucose. The systemic inflammation is what drives the insulin resistance. So on your blood work, you'll see sometimes increased fibrinogen, CRP, decreased adiponectin, increased leptin, increased tumor necrosis factor, decreased fibrinolysis. All of these things will be a hallmark of insulin resistance, chronic stress. uh, the physiology of what chronic stress does. And that's, again, one of the main points, that to treat insulin resistance, you have to treat the inflammation. This is why it's so difficult for patients sometimes to just change their diet and get results. Yes, changing diet is necessary, but it's not sufficient to reverse the inflammatory cascade that has been initiated. So when you're talking to your patients, or if anyone out there is dealing with their own issues of, can't lose weight, feeling depressed, and just systemic inflammation, you have to treat directly and very specifically and aggressively the systemic inflammation that chronic stress, that pollution, that bad diet has created. So we call that analogy, you can't shut the barn doors after the animals have left. You can't just say, okay, we're gonna change the diet and reverse and maybe even deal with stress and do more meditation and call it good. You have to herd the animals. You have to reverse the damage that inflammation has done, because once inflammation gets triggered beyond a certain point, chronic inflammation is very difficult to reverse just by itself, just by removing a couple of factors. So sleep apnea has a big role to play too. A lot of people have sleep apnea and also sleep problems. Metabolic syndrome here is at the core. Blood pressure, central obesity, dyslipidemia. So another very important tool that I use in my practice, and research supports this very much. So I'm going to talk a little bit later about why we have to be careful using hemoglobin A1C as a marker of insulin resistance. So it really is the gold standard to use continuous or consistent blood sugar monitoring. This isn't technically continuous blood sugar monitoring, because that requires a little implant where it's constantly monitoring blood sugar. But this has been used in the clinical setting to justify why hemoglobin A1C isn't always the best, doesn't always correlate with average blood sugar levels, which we'll get to. But I use blood sugar monitors as a great patient education tool, also for information for me. So if you see on a blood test that somebody has, maybe their blood sugar is in the 90s or even if in the 80s, but their hemoglobin A1C is 5.8, 5.9, and you suspect that they have insulin resistance, you really can't assume that that person is insulin resistant just on the hemoglobin A1C. You really want to confirm with using a blood sugar monitor. But it's also good education for the patient to say, all right, what foods tend to trigger my insulin resistance? You'll often hear a patient go, I can't always predict what foods. Now, a lot of times they will, and that's one of the values of this. Of course, if they're going to eat bread, if they're going to eat, I had a patient who liked to have a chef salad, and he thought eating a chef salad at a local dive diner was healthy for him. But he would load it up with his ranch dressing or whatever, and his blood sugars would consistently be in the 120s just after eating that salad. Whereas if he just ate some protein and some vegetables and maybe even a little bit of a sweet potato, it would stay, in the 90s for him, which was good for him because he had actual diabetes. So, so it's a good educational tool. But patients will often say, I can't predict. Sometimes I wake up and my blood sugar is 110, and the next morning it's at 90 or 85, and it doesn't always have to do with what I ate. So stress is one of the biggest factors. I had a patient who developed insulin resistance after her husband died. So her husband died, and she was so stressed out that her blood sugar, she didn't change her diet, she was very healthy, but her blood sugar kept rising and rising because of her chronic stress. So as soon as we dealt with that and got her on the Serene Renew and you know, targeted some of the inflammation and hypercortisol effects, then her blood sugar started going down. So that was a very good tool for her to go, wait a second, you know, I love my husband, but I don't want to kill myself in the process of grieving. So that was helpful for her to say, okay, you know, I really want to work with my stress levels here. So healthy blood sugar should never go above 100, even after a good-sized meal. So I use a blood sugar monitor on myself, or I have for many years. Just I go through periods where I use it a lot, especially if I'm trying out different foods or different diets, or you know, something like that. And even after I eat you know, a grain, or you know, something that's gluten-free, you know, which I don't do very often, but I'm pretty paleo-Mediterranean. But even after a pretty big meal, or what I would consider a high glycemic meal, my blood sugar never goes over 100, and that's nothing to say about, you know, not trying to say that my blood sugar is so perfect, but when I look at my patients who are healthy, even after a meal, it shouldn't go over 100. So that's just what you want to tell your patient in terms of what you're shooting for, what they're shooting for. It really shouldn't go above 90, 95 even after a meal. So most of the time my blood sugar is in the low 90s after a meal. It's in the low 80s fasting. So that's kind of, you know, what you want to tell your patients to shoot for. So I have them use the blood sugar monitor first thing in the morning, just a couple of days a week. It doesn't have to be every day, unless you want that information every day. And then I have them pick a couple of meals a week, or a couple of meals a day, maybe. One meal, or you know, lunch a couple of days, then dinner a couple of days, and measure it about a half hour to 45 minutes after a meal. That's sort of the peak of when you might see the blood sugar rise. You can also then have them measure it 2 hours after a meal if the blood sugar has not gone down very much. So spiking after a meal is often early insulin resistance, but then elevated elevated blood sugar for 2 hours after a meal is pretty cemented insulin resistance. It's chronic insulin resistance. It means it's been there for a while. So lowering homocysteine, another interesting correlation that most people don't realize, is that homocysteine, or an impairment in the methylation pathway, actually induces insulin resistance, and vice versa. Lowering homocysteine can improve insulin markers. So clinical study of serum homocysteine and non-alcoholic fatty liver disease in euglycemic patients, meaning, okay, these patients, now euglycemic in this term means they're not diabetic, but they're insulin resistant. So euglycemic is not meaning that their blood sugar is good, it just means that they're not diabetic yet. But non-alcoholic fatty liver disease is often what you're going to see when patients are a little bit overweight. Insulin resistance has been there and simmering for years. Even if hemoglobin A1C doesn't always pick it up, you're going to pick it up on blood work by elevated lipid, elevated triglycerides specifically, and then in later stages you're going to see elevated liver enzymes, but those are later stages. So high homocysteine can aggravate non-alcoholic fatty liver disease by increasing the reactive oxygen species, and so it increases the oxidative stress and inflammation. Insulin resistance and homocysteine were predictors of non-alcoholic fatty liver disease. So again, if you had insulin resistance, if you had high homocysteine, you were more likely to have or develop non-alcoholic fatty liver disease. High homocysteine also correlated with the severity of insulin resistance. So again, the higher the homocysteine, the more severe and the more progressive the insulin resistance ended up being. So homocysteine here in this study was an independent risk factor for non-alcoholic fatty liver disease. So, and they looked at all kinds of things. They looked at BMI, total cholesterol, you know, fasting plasma glucose, and homocysteine was one of the strongest there. So lowering homocysteine actually decreases the risk for non-alcoholic fatty liver disease and should be a frontline or first line defense that you think about when someone does have elevated triglycerides is get them on the methylrenew, get them on the N-acetylcysteine, and you'll see the blood sugar lower, you'll see the homocysteine lower, and you'll see if they have elevated liver enzymes. I've actually seen quite a few non-alcoholic fatty liver disease patients over the years, and they're healthy. They have no symptoms. Every single one that I've diagnosed has been completely shocked. They know they're overweight. They know they don't feel great. But when I tell them their liver is being infiltrated by fat tissue because the body has had high glucose for so long and high insulin that the insulin is telling the glucose to be deposited in the liver, so much so that it starts destroying the liver cells. So they're pretty motivated at that point. That geez, not only do I want to lose weight, but I kind of want to save my liver as well. So in this study here, homocysteine upregulates something called resistin production from adipocytes in vivo and in vitro. So resistin is something that's secreted from adipose tissue, and resistin is the higher the resistin, the more, which as the name implies, increases insulin resistance. So homocysteine impaired glucose transport, and one of the mechanisms that it does that is increasing this resistance. So very interesting. Not very many people talk or understand or know that homocysteine and impaired methylation in itself is a risk factor and a contributing etiological factor for insulin resistance. So pretty interesting. In addition here, homocysteine-induced resistant expression was attenuated in the study by treatment with N-acetylcysteine. So the N-acetylcysteine was able to increase glutathione production and decrease the oxidative stress that was caused and save the insulin receptors. So resistin is also known as FIZZ3. It's found in the inflammatory zone. And interestingly here, too, in this study, administration of lipopolysaccharide, which is elevated in people with leaky gut, which is oftentimes induced by stress, increased also circulating resistin levels. So any kind of inflammatory insult to the body, specifically here homocysteine and lipopolysaccharides, increased resistin, increased interleukin-6, and increased tumor necrosis factor alpha. And again, in this review, all of which can be attenuated by N-acetylcysteine, grapeseed, which is in the BP Renew, curcumin, sulforaphane, lipoic acid, and the methyl Renew, the curcumin and sulforaphane in the methyl Renew, and the lipoic acids in the BP Renew. So we have powerful, powerful tools if we just know how to apply them. It's not as simple as just telling somebody, hey, you've got insulin resistance, let's change your diet, let's get you exercising, let's have you take a few supplements. You've got to know which ones are going to give you the best bang for your buck, because patients now, this is not covered by insurance, and we want to make sure that the supplements that we give our patients are the ones that are going to have the greatest impact. And so Methyl Renew, NAC, BP Renew, and the Serene Renew are ones that I use in almost all of my patients with insulin resistance, and especially stress-induced insulin resistance. So again, possible integrative actions of leptin and insulin signaling. So again, one of the things that happens once you develop a little bit of adiposity due to insulin resistance is, we all know you start secreting more leptin. But the higher the leptin, and actually we see that it increases something called endoplasmic reticulum stress by increasing protein tyrosine phosphatase 1b and suppressor cytokine signaling 3. So just increased leptin will will damage the endoplasmic reticulum and then increase more inflammation and more insulin resistance. So, so endoplasmic reticulum here is what takes your nucleus, your genes, and transcribes your genes into proteins. So if you damage the machinery that your cells use to express their genetic code, to express cell proteins, your cells can't function. I've had patients ask me before, why have I tried to lose weight, using everything, Weight Watchers, or have gone to this clinic and that clinic, and they don't understand why. They're happy, but they don't understand why they've really lost a lot of weight very quickly on my plan. Even the diet isn't all that different from what they've tried before, but it's because we focus on this oxidative stress and this inflammation. We repair the endoplasmic reticulum using the tools that we have, the lipoic acid and the grapeseed and resveratrol and curcumin and the N-acetylcysteine. It's amazing at how it works, and we've got the studies to prove it. So endoplasmic reticulum stress is something that it's just a mechanism to understand. There's no test necessarily for it. Actually, there is a test. It's an organic acid called A2 guanosine, deoxyguanosine. You can order that from like Genova or anyone who does oxidative or organic acid testing. Genova, Great Plains Laboratory. That's actually a very good endoplasmic reticulum stress marker is the 8,2 deoxyguanosine. So if that's high, they're under endoplasmic reticulum stress. But it's also just something for the practitioner to know. As you know, the ultimate clinician knows physiology, not just what to do, but it knows the physiology. They know the physiology behind what's really going on. So endoplasmic reticulum stress induced by lowered antioxidant status, which is where the methylation comes in. If you're not methylating, if you have high homocysteine, low glutathione, you are at a huge risk for developing or worsening insulin resistance and diabetes and that kind of metabolic syndrome. So the other thing we're going to talk about is pollutants today, how pollutants and heavy metals, not just psychosocial stress, but pollutants and heavy metals, we call those obesogens or diabetogens, chemicals in our environment are a huge underestimated factor of stress on the body and inducer of insulin resistance. So overeating, lack of sleep, genetic SNPs here, so all of these need to be addressed. Reduce as many of these xenobiotics and overcooking your food and heavy metals, alcohol, pollutants, cigarette smoke, too much exposure to sunlight, gamma radiation. We all need exposure to sunlight to reduce reactive oxygen species, vitamin D, but here they're saying just too much. But so these supplements that we use, N-acetylcysteine, methylation, resveratrol, all of these things are critical for repairing the oxidative damage to the cell itself caused by endoplasmic reticular stress and inflammation. One here, too, that I want to talk about is melatonin. I don't hear a lot of people talk about, I go to seminars, I read, I spend at least 10 hours a week reading studies and doing research. If I'm getting ready for a presentation, sometimes that's 40, 50 hours a week. But you don't hear a lot in terms of insulin resistance, people using melatonin as a frontline treatment for insulin resistance. But we know it works, and we know why it works. Melatonin is a pleiotropic hormone, meaning it produces more than one effect in different tissues, depending on where it is. In the gut, it triggers cell repair. And we know in the brain it can help induce the sleep. It can also act as an anti-inflammatory and antioxidant. It's produced 24 hours a day. That's what people sometimes don't know. I've had people take melatonin throughout the day, especially if they're suffering from lack of sleep and insomnia. And, you know, it sounds counterintuitive. Why would you do that? It kind of wouldn't that mess up the circadian rhythm? But it's not something I do a lot. But that's not the case, because melatonin will be used in the gut during the day to repair, and not in the brain to induce sleep. There's many other factors needed to induce sleep and change the circadian rhythm there. So in this study here, inflammaging, metabolic syndrome, and melatonin, a call for treatment studies. This is just recently in neuroendocrinology. So they're just, again, a reminder of the mechanism. Adipocytes secrete pro-inflammatory cytokines as well as leptin, which trigger a vicious circle of additional weight gain and inflammation and toxicity. We've talked about that. But melatonin melatonin, a compound known to possess direct and indirect antioxidant properties, can be used to protect, and indeed clinical studies show it can reverse insulin resistance. Melatonin levels are more strongly reduced in diseases related to insulin resistance. So you get kind of a cause and effect thing, where decreased melatonin can actually contribute to the advancement of insulin resistance, and then insulin resistance in and of itself can cause a decrease in melatonin. So the clinical data supports the possible therapeutic use of melatonin in patients with metabolic syndrome. So you don't need a lot, although there are many drugs out there that have been developed, pharmaceutical drugs that are melatonin analogs that are designed to attach onto melatonin receptors and work 24 hours a day, and it's the equivalent of 50 sometimes to 100 milligrams of melatonin. Now that's, you know, I don't think you need to that. I mean, that really is super physiological amounts. I don't think you need that much. I'm more of a proponent of using just 1 to 3 milligrams to support the antioxidant properties, to support insulin resistance, to support proper sleep cycles. You don't need a lot for most people. I can talk for 6 hours on all the benefits of melatonin, but people do often need it. And you know, in an ideal world, they wouldn't need it for very long. The body, you support the body through the methylation process for them to make their own methylation, make their own melatonin. But in reality, and the oxidative stress that we're all exposed to, melatonin can be, in and of itself, a very good therapeutic treatment. So here we know this is melatonin here. The M is melatonin. So the negative means it downregulates. The melatonin, we know, downregulates the tumor necrosis factor alpha, downregulates TH1, or upregulates TH1 if it's downregulated. So the melatonin can inhibit the macrophage inflammatory and even autoimmune damage that happens with macrophage activation. Melatonin decreases the cellular adhesion molecules here, so it decreases your risk for cardiovascular disease. It decreases NF-kappa B activation, which is, again, one of the greatest inducers of insulin resistance. Inflammation by several mechanisms is the greatest inducer of insulin resistance. I just want to say that again because it's just really important to get that. Also, interestingly enough, melatonin is used to repair the mucosal barrier in leaky gut in the gut. So that's another reason why I have people use melatonin, is to restore leaky gut. And we know leaky gut actually is one of the main causes of insulin resistance. Leaky gut precedes insulin resistance as being one of the main contributing factors. So treating leaky gut is also a very specific focus that you want to have. Even minor sleep deprivation causes elevation in inflammatory cytokines. Now, I say this with caution, all right, because I deal with sleep a lot in my practice, a lot of patients with sleep problems, as you probably see in your practices as well. One of the worst things you can tell your patient is how damaging not getting enough sleep is, because that just creates more of a stress that they're not sleeping, and then that can create more performance anxiety, before they try to go to sleep, and then they go, I gotta get to sleep, it's so important, and then if they don't sleep, then they get more irritated and more frustrated. So that can be one of the worst things you can tell your patient. At least, you can mention it, but the treatment, one of the main treatments for insomnia is something called cognitive behavioral therapy for insomnia, or CBTI, and one of the hallmarks of that is to help patients get over their negative thinking about sleep, and reverse some of those thoughts that it's going to hurt me, and I'm really, this is bad, and I've got to get to sleep. So so it's true that sleep is damaging, and not getting enough sleep is inflammatory. Not getting enough sleep is damaging, but sometimes harping on that and really focusing on that on your patients is not the best treatment. But for our understanding and for our ability to apply the right treatment for the right issue, we have to understand what not getting enough sleep does. It activates microglial and neuronal destruction. It creates inflammation and alters neurotransmitter metabolism, usually by increasing MAO activity, activates something called NMDA, which are excitatory neurons, and then of course we know inflammation then adds more, all those inflammatory cytokines in turn causes more of this damage. So the melatonin can really help, and the Serene Renew as well, help with that stress about sleep. Again, sleep loss and inflammation, 6 hours of sleep or less, even if just one night, induces NF-kappa B, activation of toll-like receptors, which are involved in the hyperimmune response and autoimmune disease. I will be talking or giving a lecture. That's kind of my focus this year, but I'll be giving a lecture in Tampa, Florida, in about 6 weeks, March 18th, 19th, I believe. Those are the dates, but it's March 18th, 19th, that weekend, and the whole weekend will be devoted to autoimmune disease, and a good portion of that is this kind of mechanism. Will go into why sleep deprivation and other stress issues activate toll-like receptors and induce hyperimmune responses and leaky gut, and why that's so critical in addressing your patients with autoimmune disease. So it increases cortisol and catecholamines, not getting enough sleep, increases risk for obesity, lowered glutathione, leading to mitochondrial and endoplasmic reticulum destabilization. So just this kind of important here of how using melatonin can be a very important frontline treatment for insulin resistance. We know melatonin peaks early and then declines pretty steadily with age. By the time you're 40, 45, it's going down. It has gone down pretty significantly. So melatonin and leaky gut here, just another study of how melatonin reduces bacterial translocation by preventing damage to the intestinal mucosa. So pretty good early models of how melatonin can repair leaky gut and treat dysbiosis. So again, SLP by NutriWest has 1 milligram of melatonin. So I did that because again, there's supplements out there with 5 or 10 milligrams, but I think that's harder to dose. You don't want to start off with that. Sometimes just 1 or 2 milligrams can be extremely helpful and powerful. So, and then 50 milligrams of Phenibut. It's the only sublingual melatonin product on the market that I know of that combines melatonin with Phenibut, which activates GABA receptors and also reduces stress response and reduces the hypercortisol and reduces the inflammation associated with the stress response. So the SLP has the Phenibut, and so does Serene Renew. So by the way, Phenibut in and of itself does not induce sleep. It's just an anxiolytic. So that's why we have it in the decreases anxiety and stress. That's why we have it in both the SLP and Serene Renew. So just another study here that oxidative stress induces insulin resistance by directly damaging the GLUT4 transporters. Again, homocysteine here inhibits insulin signaling, so another study about lowering homocysteine and increasing glutathione completely abolishes the effects of that high homocysteine damage to the insulin receptors. So pretty amazing stuff. It's been known, but again, I don't think practitioners really think of that right off when they see a patient with insulin resistance. So there's something also called atropine here. So this is something new that a lot of people haven't heard about yet, but there's something called atropine that is secreted by muscle cells and fat cells too, but atropine is actually a molecule that increases insulin sensitivity. We want atropine. It upregulates glucose oxidation, which means it actually breaks down glucose the way it should be broken down, and that's what we want to do to reverse insulin resistance. The hallmark of insulin resistance is the lack of glucose oxidation, which means glucose is being broken down into ATP. So this is important for insulin resistance, and it's important for like chronic fatigue syndrome and post-exercise fatigue and things. So here they actually used acetyl L-carnitine, also CoQ10. It was very good at increasing atropine. So acetyl L-carnitine is something you want to make sure you have. NutriWest has total L-carnitine, which has the L-carnitine in it. Other nutrients for increasing atropine, again, the BP Renew, the lipoic acid in grapeseed, curcumin, N-acetylcysteine, methyl Renew. Atropine is very similar to sirtuin in that it responds to these nutrients, and sirtuin helps reverse vascular damage due to oxidative stress. So interestingly, lithium too has been shown just 10 to 50 milligrams a day, not pharmacological doses used for people that have manic depressive or bipolar. You're talking about thousands of milligrams for doses, but we're talking just 10 to 50 milligrams a day. Which is very safe, and you can get that as a non-prescriptive thing. So just kind of an interesting aside there. So methyl Renew again will increase atropine and increase your glucose breakdown into ADP. BP Renew. Diabetogens. We've talked about this already a little bit earlier, but diabetogens, persistent organic pollutants, are known to cause mitochondrial dysfunction, and this in turn is linked to insulin resistance. So detoxing and being aware when my patients ask, do I really need to be organic? Do I really need to eat organic foods? I'm always reminded of studies like this one, but also studies that show mothers who live near closer to farms that use pesticides have greater chance of having children with autism and insulin resistance and other metabolic issues and brain issues and neurological deficits. So pretty interesting that patients don't, you can't see it, touch it, smell it, and a lot of practitioners don't place enough emphasis on the importance of living a clean, healthy lifestyle, eating organic and having air purifiers in your home and just having a clean lifestyle and avoiding chemicals in the home and cleaning your house with vinegar and things that aren't full of chemicals. The amount of chemicals we get exposed to on a daily basis is phenomenal. So there's actually a good book that's coming out by the author of the nutritional medicine textbook, Pizzorno, and he's done 30-some years of research into nutritional medicine, and his sort of ultimate conclusion in his time in the natural medicine field and teaching nutrition and for 30-plus years is just the effect of these diabetogens and these persistent organic pollutants are paramount in the developing of insulin resistance and Alzheimer's and neurodegenerative diseases and chronic fatigue syndrome. So we really do want to pay more attention than just giving it lip service. So diabetes, this is one of his studies here recently, is the diabetes epidemic primarily due to toxins? And, yes, we know increased sugar consumption and obesity and lack of exercise, all these contribute, but the environmental toxins might be even greater than all those combined. So the data are so compelling that some researchers now label these toxins as diabetogens. And I've talked about this before in other classes, but obesogens or diabetogens, these are used interchangeably, but there are a lot of them, and things like glyphosate or Roundup and many different pesticides and herbicides cause this. So it is important to try to avoid these in our diet, and it's important to detox, make sure that we have enough of a resource, a reserve in our liver to detoxify these things. So LV Renew is one of my favorite. I take it every single day myself. It's got, again, it's got the milk thistle and the N-acetylcysteine and burdock root to assist in the detox of these chemicals. But I also use the Methylrenew, Renew, BP Renew, Complete Whey G, Phyto Greens, and Phyto Renew, phytonutrients, so eating a good, clean, healthy diet, but also supplementing with greens powder and the Phyto Renew powder. These are antioxidants. They help detox, and they are imperative in reversing insulin resistance. So I often have my patients do a shake in the morning with the Complete Whey G, the Phyto Greens, and the Phyto Renew powder every morning, and just water. I don't let them use all the alternative milks or regular milk, no sweeteners. If they want to put it in their blender with some greens, that's fine, some extra greens, kale or whatever, but make sure that they're getting at least 30 to 40 grams of protein first thing in the morning. So here's the LV Renew, milk thistle, NAC, green tea extract. I've already talked about leaky gut and diabetes. What we know is that leaky gut induces inflammation, which then induces insulin resistance, but what's important is that it precedes here. It precedes and is one of the main contributing factors to insulin resistance. We know zonulin gets upregulated with consumption of wheat and also bad bacteria, and that zonulin decreases the blood, the barrier and the tight junctions, activates your antigen-presenting cells. These are your macrophages that increase your cytokines. And these cytokines, this is type 1 diabetes. I've seen this time and time again, and we're going to talk about this a lot in my autoimmune seminar. But leaky gut is imperative for, and it's a prerequisite for most for developing most autoimmune diseases. But here, type 1 diabetes, we know the mechanisms. It can be induced by viruses, it can be induced by bacteria, it can be induced by antibiotics that kids take, and then that induces leaky gut, which then in turn induces these macrophage and T cell activations to attack the beta cell. But in here in type 2 diabetes on the right, it's a similar mechanism, except the cytokines destroy the insulin receptor and glucose oxidation mechanism. So just interesting to know, and why treating the leaky gut for all insulin resistance and autoimmune is imperative. So this is another good schematic of all the inducers of leaky gut, like stress, medication, enzymes, neurotransmitters, neuropeptides, intestinal flora, immune dysregulation, and then you get this, it looks very complicated, but ultimately you get this immune activation and damage and autoimmune triggers. So treating the leaky gut, removing as many of these inducing factors as possible is imperative. So, all right, I'm going to talk. We're almost done here. Thanks everybody for hanging in there. I think most of you are doing great out there. But I want to talk a little bit, just a couple more minutes, about hemoglobin A1C and why you can't always trust hemoglobin A1C, especially, interestingly enough, especially in our population, in the healthier population. So, so we know hemoglobin A1C. You can read about it here. It's a specific type of hemoglobin that is particularly sensitive to glycosylation, meaning that it's a non-enzymatic reaction, meaning that it's simply the higher the levels of glucose. That's the rate-limiting step in glycosylating hemoglobin, and it's an irreversible step. And since the red blood cells, the average lifespan of a red blood cell is about 2 to 3 months, then you get a good 2 to 3 month look at your blood sugar levels. However, so interestingly, it is an accurate measurement. So I want everyone to understand that hemoglobin A1C is very useful and very valuable. So we still use it. I still run it on all my patients. But I noticed something that got me researching this. I noticed that my patients who I've had for years, and myself too, you know, who take a lot of antioxidants, who are very healthy, we have a very good diet. Insulin resistance, so when I treat somebody with insulin resistance and we use a lot of these antioxidants that we've talked about today, the hemoglobin A1C goes down and everything, you know, is looking really good. But after a year or two, what happens is the hemoglobin A1C, even without the patient changing their diet any or changing their lifestyle, the hemoglobin A1C was creeping up, back up again. And I thought, okay, what's going on here? So I actually did what I mentioned in the beginning of this webinar. I started using more and more the continuous glucose monitoring, or the finger stick, and so I had these patients who had this slightly elevated hemoglobin A1C, like they would be starting to go back into the 5.6s or 5.7s, even 5.8. I'd be like, what's, you know, they're not gaining weight, they've lost weight, they're really healthy, and sure enough, their blood sugars were always great. It was always in the 80s, you know. So before meals and after meals and fasting and at night and even during stressful times, their insulin and glucose systems were working properly. So why was hemoglobin A1C starting to rise? Well, in investigating, I realized that, and it makes sense, but people don't often make these connections. The other part of the factor of glycosylating hemoglobin is not just the blood sugar, but the hemoglobin itself. So, and the lifespan of the red blood cell. So, to put it simply, and you can read what read some of these other things that that influence hemoglobin A1C. But it's important that, in general, anything that increases the lifespan of the red blood cell will increase hemoglobin A1C falsely. And I say falsely because it's not really a reflection at that point of their average blood sugar levels. It's not a great reflection. It still can be, but if you are taking a lot of antioxidants, which I do on a daily basis, and it's a great thing, and I'm convinced, and the scientific literature is pretty clear that taking antioxidants, and you know, the BP Renew and the Methyl Renew and the LV Renew, those things are imperative for health in this day and age. But what happens, one of the things that happens is it makes cells healthier, including the red blood cells. So now the red blood cells are lasting longer in the blood, right? So the average lifespan of a healthy person's, or what I would call, super healthy red blood cell is now longer than 3 months. It's more like 4 or even 5 months. So what that does is that increases the time that blood sugar or that red blood cell is exposed to average levels of glucose. And so even average levels of glucose will cause glycosylation. So you're just increasing the time that red blood cell has to be glycosylated. So you get a very modest, we're not talking a huge point, we're not talking enough to put it into the sixes for most people, but it's important that if you've been working with somebody or someone's coming into you and they're taking a lot of antioxidants, confirm that they have insulin resistance if you suspect it with using the blood sugar monitors. Don't just say, oh, you have high hemoglobin A1C. Now, if their fasting blood sugar is also, in the 90s, upper 90s, mid 90s, then and their hemoglobin A1C is high, then I'm more confident that that person actually does have insulin resistance and they're not taking any antioxidants. Then I know that that's probably pretty accurate. So conversely, okay, you could be missing, if you're just looking at hemoglobin A1C, you could be missing in actual cases of hemoglobin A1C, so you can get a false negative as well. So you can get a false positive, but anything that decreases the lifespan of a red blood cell, like thalassemia beta minor or sickle cell anemia, actually sickle cell, some thalassemia beta minor and sickle cell will increase hemoglobin A1C because it changes the structure of the hemoglobin and it's more likely to be glycosylated. But hemolytic anemia, so other kind of anemias that destroy the red blood cell quicker than it should, or someone who has a lot of oxidative stress or low glutathione status. Glutathione is the main protector of red blood cells. So if you don't have enough glutathione, then those red blood cells are going to be turned over quicker and the hemoglobin A1C is not going to be as reflective for insulin resistance. And you've probably seen those patients. They come in, they're overweight, and you're almost positive. You just know that they're insulin resistant. But the blood sugar doesn't look too bad because that's the fasting blood sugar isn't always a sensitive indicator either. And their hemoglobin A1C doesn't look that bad. So you have to look at, so have them do the glucose monitor, have them also, you can look at triglycerides. That's another really important, that will start to go up sometimes even before fasting blood sugar or hemoglobin A1C if they have a lot of oxidative stress. So hopefully that's clear to everyone, and you might have to listen to this several times, but anything that increases the lifespan of the red blood cell in general will increase hemoglobin A1C falsely. It does not mean that their blood sugars are higher. Anything that lowers the lifespan of the red blood cell outside of normal, like low glutathione or other hemolytic anemias, autoimmune disease, will falsely lower the hemoglobin A1C. So just really important to understand what hemoglobin A1C is, and understand the limitations. I still use it. It's a great test, but understand the limitations of it and the applications of it. So again, antioxidants such as lipoic acid, glutathione, and acetylcysteine will improve blood sugar physiology in almost every case. So they're absolutely imperative to use. However, long-term therapy will increase this, and researchers are starting to catch on to this. So in this study here, effective CoQ10 diabetes, it improves blood sugar markers, but it didn't improve hemoglobin A1C. So it lowered insulin levels, it lowered blood sugar levels, but the hemoglobin A1C didn't quite change as quickly because you're increasing the lifespan of the red blood cell at the same time, because CoQ10 is a great antioxidant for that. So same thing with ascorbic acid. It showed very significant, just using ascorbic acid, lowered blood sugar and metabolic syndrome markers, but not hemoglobin A1C, and that's one of the reasons. This is the main reason why, because it protects the red blood cell. So in conclusion, insulin resistance is more than just diet. It's stress, it's inflammation, it's lack of sleep, it's obesogen and toxin exposure. So I wanted to give everyone today some more tools in their toolbox. There's more applications to give to your patients to get better results, to get quicker results, to address more issues for your patient, to help them be healthier and achieve health much quicker. So Serene Renew is something that people should think about when someone has insulin resistance and stress and hypercortisolism. Serene Renew, NAC Renew, Methyl Renew improves methylation and lowers homocysteine, which improves blood sugar. So I think that's another important point from today is homocysteine we know induces insulin resistance, increases or lowers the adiponectin and stuff. So BP Renew improves insulin sensitivity, reverses metabolic syndrome. LV Renew, detox from obesogens. SLP Renew with the melatonin improves leaky gut, decreases inflammation, and improves insulin resistance. And treating your leaky gut is imperative for reversing autoimmune disease and insulin resistance that we've talked about. So I use Glutamine Plus. I didn't talk about this, but I will in future seminars and webinars, but Glycan Renew I use as a first-line therapy for leaky gut as well, because it's got a lot of mushroom compounds that have been shown to reverse leaky gut. So the last thing I'll leave you with is the understanding that what we are today comes from our thoughts of yesterday, and our present thoughts build our life of tomorrow. Our life is the creation of our mind. Basically, our thoughts today, if we want to be healthy tomorrow, if we're having stressful thoughts, anxious thoughts, we need to catch those and we need to reverse those. That is a cornerstone of treatment in most modern diseases, so just wanted to throw that in there. My upcoming lecture, March 18th and 19th in Florida, just call NutriWest of Florida, and I think the early bird, you get a $50 discount if you sign up before the early bird cutoff, which I think is maybe mid-February or the end of February here. We'll talk about the role of leaky gut, infections, the role of infections in autoimmune. We'll talk about laboratory tests. We'll do real case studies of complete reversal that I've had of autoimmune disease. So it's one of my favorite things to treat, and it can be so simple, but a lot of practitioners aren't really I don't think have all the tools necessary. So, and if anyone's interested in more, I've got dozens of recorded lectures, as most of you know who have heard me before. So feel free to contact me at Harmony Healing Center, pc@comcast.net, or you can call my office here in Colorado. So, so thank you everyone